Aloha, everybody. Aloha Friday with the Sandwich Island Social Network. Welcome aboard. So great to have you join us. Of course, every Friday we are here with fun conversations, interesting conversations, as we have folks from our community share their lives and their journey. And you are going to really enjoy the time that we have together with our guests. The Sandwich Islands Social Network is a nonprofit organization serving Hawaiians and Hawaiians at heart away from their island home. Now, the music that you just heard was off of a project by the Sandwich Islands Social Network that is available on iTunes. You can hear samples of it also on YouTube. That Slack Key was by Tidan Hofstad, who is island boy living here in California. The name of the album is Mauka, California 808 Makai. It is a project by the Sandwich Islands Social Network. All profits and proceeds from the sale and downloads of all of the music goes to the Sandwich Islands Social Network. Check it out on YouTube and on iTunes. Down below, you'll also see a scroller. We are a 501c3 nonprofit organization serving Hawaiians and Hawaiians at heart away from their island home. And tax deductible donations are gratefully accepted. You can learn how you can be a sustaining member of our ohana by going to patreon.com/Sandwich Islands 808. And you can see that scroller right there as we go into our show. Fantastic. Alrighty then. We want to remind you and all of our friends that are watching that this is a Facebook Live broadcast, and the Aloha Friday show with the Sandwich Island Social Network is a live, interactive, chat-driven show. So we welcome your questions, your comments throughout the show. We would love to hear from you. We are so pleased that Leolinda Iokepa accepted our invitation to join us on the Aloha Friday show. And so we would like to say aloha right now. It is early in the morning. It's around 9 o'clock in the morning over here. Good morning.
Good morning, good morning. Aloha kaka hiaka. Oh,
So you got minor birds chirping out there? You got any of the wilderness noises going on besides
yeah, we got some minor birds,
minor
we got
birds?
some rubbish trucks today, and the koki haven't hit yet, so it's too early for koki
Oh,
frogs, but we don't have them here in Paoa Valley yet.
not yet, huh? Oh, I didn't realize that Koki had come to Oahu. I thought it was only Big Island.
Every now and then we think there's a couple, and I think the neighborhoods have tried hard to keep them away,
Yeah.
but every now and then we're driving, we can hear one or two, but
Might,
yeah,
you
we're
know what?
very cautious.
Might be just a couple tourists. Couple tourist Koki. Couple tourist Koki. They come on. Sometimes they want to take a break from Big Island and travel a little bit.
That's right.
So and hopefully they go back. But yeah. Oh my goodness. That's like I have some dear friends live at Haleiwa, and sometimes when I go back home, I stay with them out in Haleiwa, and at 4:30 in the morning, it's like right, and all the rooster serenades. So in the morning, having breakfast, he goes, "Brah, I'm so sorry about the roosters." I said, "You know what? That rooster serenade takes me back small kid time, growing up on down Sunset Beach and Kahuku and Wailua and all of that. So that put me right back to sleep. I love hearing the roosters."
There are a few wild peacocks
Oh,
roam the neighborhood. And
ah,
every now and then a boar will come out from the back of the valley down the middle of the road in
wow,
control.
wow, wow.
I will say the chickens in our neighborhood though, they cross the street using the sidewalk. I mean using the crosswalk. They
Oh,
use the
crosswalk.
crosswalk. It's amazing. The mama comes out with her babies.
Yeah,
They're on the side, but they use the crosswalk. It's we got really smart chickens in Paoa.
I think the peacocks when hitchhike from Makaha, they get a lot of peacocks Makaha side. So they like come uptown and visit you guys. Oh my goodness. Leo, thank you so much again for joining us. And I have such great anticipation, and I'm really, really fascinated in the work that you have done over the years. As I've looked over your work here, I know that over the years you have been affiliated with healthcare and for over the last several decades, administration in healthcare. community engagement, special healthcare needs. And this has kind of been your passion for a number of years. So how does this start with a Hilo girl, St. Joseph? Hello, a good St. Joseph in Hilo High School coming out there in the '80s. And how does this passion for healthcare and administration and community involvement, how did that start with you?
Yeah, if you had asked the younger me if I would ever see my life this way, I would have said no. So I decided when I was 7 years old that I had wanted to be an attorney, and everything I had done in the process would put me in that position. And so by the time good old St. Joseph's, everything I did at St. Joe was related to that. And then went to UH Hilo, got my degree in political science, and then moved to California. So I've been with your audience, I lived in Southern California to go to law school. And what I realized was that it wasn't for me. I loved I just love the law. I love the process, but the whole idea of just the rat race with being an attorney just didn't sit right. And so I figured, you know what, I better go find one job because I don't want to go back to Hilo. I'm not ready yet. And so there was an ad in the newspaper for electronic data systems, who at the time was running the California Medical program. They had just taken over. It was like about 1988. And they needed people who could talk from 3 to 1,000, were analytical, had good customer service skills, and had a medical background. So I figured, oh, I can do that. So I set off my resume, and then I get a phone call from the recruiter. So he calls me in the morning. He says, okay, well, we see you applied for this position as a regional representative. So the job was for me my territory was from Long Beach up to San Luis Obispo, and to troubleshoot problems. So if there was a provider that called their legislator, I had 48 hours to figure out what was wrong with their billing, what was going wrong with Medi-Cal. So okay, so we got the analytical part, crowds from 2 to 2,000. I was like, oh no, easy. He said, what's your medical background? I said, oh, my cholesterol is 150. And the guy says, oh, not that kind of medical background. I'm thinking, what is he talking about? I'm in my 20s, right? So, I'm not as humble as I am now. And he says, have you ever worked in a doctor's office? I said, doctor's office? I said, oh, my godparents were physicians. And they're like, okay, you know what? Why don't we bring you up to Sacramento? And I was living in Southern California. Why don't we bring you up to Sacramento and have you interview in person? So, so I go and I interview, and so they tell me, they said, this region that we're looking at includes Watts, and we need somebody who's able to work with the community. Wow. And 23-year-old Leolinda says, I'm from Hawaii. I can talk to anybody. And that got me the job. And then it became like air to me, oxygen, that this whole policy side of healthcare really got into me. So, so I had done that. I had done the payer side of the program, the government programs. And then I got recruited to do consulting work for LA County hospitals. So I got to do the provider side. I had gotten married, and we decided, let's go back to Hawaii and have our family there. So came back to Hawaii. We began our family. And then our first child, when he was 22 months, had gotten diagnosed with a pervasive developmental disorder. I'm sorry. Yeah, it was 22 months old, which was, we now know, in the autism spectrum. And so I had, immediately we got him into services. And then I realized that, I had sat on every single seat except the consumer side of healthcare until now. And so the advocacy piece really came to being a mama trying to figure out what was going on with my child. I will tell you that this is about 1990. This is about 1995. We actually had bookstores back then, right? So down to the bookstore. I cannot find anything in the bookstore at all about pervasive developmental disorder, but I found 2 books on autism, and really felt like there's a lack of information that was available. And how do we change that? Luckily, one of his landing spots was an organization here locally for an early intervention program for services 0 to 3. And the woman who was in charge, name was Josie Wall, became a mentor to me. She was one of the founding organizers of a national grassroots organization called Family Voices. And the idea was that families need to be at the seat of the table. And she recruited me to be the, our state coordinator for Family Voices, because, I had all those background. Now, I think two things. One is, having been born into a family that had disability. My mother from her first marriage had 2 children, and her oldest child died very early. And we think now it was probably like a metabolic disorder. But her second child, my half sister Renata, had cerebral palsy. And back then, people hid their children. Not my mom. My mom, when that child was born, said, "This baby's going to have the life that every child should have." She had a baby luau with families and friends. She went to church on Sundays. My mother made it so that disability was very natural to us. And so that was kind of the ethic that I grew up in, especially in multi-generational families, loving my grandparents as they aged. We were able to take care of them. They aged in place. So, you asked me, how did I become who I am? I think part of it is one, culturally and naturally, this was part of it. But, really kind of realizing that perhaps all the things that made me want to become an attorney were really about me being an advocate and taking those skills to help others as well as our family members navigate this crazy healthcare system.
Wow. So, how did, as child health advocacy, now there's a partnership with other family professionals with voices. How did, now there's like kind of like you kind of building these
Right,
relationships?
right. So, as you mentioned, as we talked a little bit about earlier, I said, parents, used to, hide their children with disabilities, or they went to special schools, or some, some families sent their children to Waimanu home on Oahu and never saw them again. And they were adults, right? So, that kind of all changed in the late 60s and the 70s with special education law. And so Josie Walls, I mentioned, one of those early founders, really moved that. But it wasn't until Surgeon General C. Everett Koop, you remember Koop, the guy with the beard and the mustache? He convened the first conference on family-centered care, and this was kind of revolutionary. Now, this is what we expect of our healthcare system now, but imagine a time that this doesn't exist, where families actually were part of the decision-making process. They just weren't told what to do; they were engaged. Yeah. And so this whole idea of family-centered care really became pivotal and continues to be pivotal as we navigate through the system. So in the the mid 90s, there was a very strong effort to really promote family-centered care, both at a federal level, at a state level, and with professionals. Now, I will tell you, for many for many healthcare providers and physicians, that was kind of tough, because now you had people not necessarily questioning, but they were beginning to ask questions, and so, there became an effort that we got to teach partnership, we got to teach relationships. Yeah. Something that's very intrinsic to our Hawaiian culture. It's like, oh, all we got to do is just export that, right, along the way. So the federal government actually had provided some seed money to states to create family-to-family health information centers, in which families could talk to other family members who are going through the same kinds of things to get advice. Because not all knowledge, as we know, in the Olelo No'eau comes from one school. We have to provide venues for many. So in these early years of really promoting family-centered care, we had an opportunity to partner with our Hawaii Health Department, a Children with Special Health Needs branch, Dr. Patricia Hugh, with our American Academy of Pediatrics, and their leadership there, led by Dr. Calcia. and our university system, our training program, with Dr. Louise Iwaishi, that we created this hui that was really committed to moving forth these values of family-centered care. And in one of our very first efforts, we're thinking about how do we bring everyone together. So I went to, where do you go? You go back to your elders, right? So I had an opportunity to sit with Kahawanu Lake, and I asked him, I said, we need a name for our project. And he sat and he said to me, you will call it Hilopaʻa. And yeah, right, you will call it Hilopaʻa, and it translated to mean braid firmly. That what you're trying to do is braid into a system of care, not only the professionals, not only the payers, but also the families and the people that they serve themselves into the strong braid. And I love that image. In our history, especially being from Hawaii Island, we talk about Hilopaʻa. The stories talk about how they would create these braids, these lei, to tie the canoe to the shoreline in the Wailuku River, and that no matter how rough the river was, that tie, that Hilopaʻa, that braid would hold the canoe in place. And so, for us, that's a beautiful image that no matter what happens, if we unite, if we braid together, we can weather any storm. From that moment on, we've been operational and being able to be Hawaii's family to family health information center. We have a team of parent advocates and family members of children with special health care needs to be able to answer questions, provide support, and really also do at the not only the one-to-one support, but also at a systems level, at the state level, at the national level, to be able to share the voices of our Hawaii families uh, and promote the good work that is being done and continues that needs to be done.
It seems that it came at just the right time too, right? Because there was more and more awareness of what the needs were, right?
Yes, yes, yeah.
Coming out of the 60s and 70s, looking at what was happening across the country, across the globe, and seeing the needs for these kinds of health care issues being taken care of and addressed with, and going all the way up to state, national levels of laws being passed. Sometimes we had to kind of catch up to what was happening to put those laws, to execute those laws, put those laws in place, but without something in its place to execute those laws, it doesn't have any power to it. So,
Absolutely.
yeah.
Absolutely. And that's what happened with deinstitutionalization, right? When the state closed Waimano Home, the community had to catch up very quickly on how do you support these individuals in the community. How do we share with families? Like, my mom was the anomaly. She kept Renata home with her. In fact, the doctors had said to her when she was born, she's probably not going to live more than a month. You should put her in Waimano home. And my mom said, no, thank you. But I think she had some other 4-letter words she said. She said, no, thank you. I will take this child home and I will love her. And she didn't die at 1 month. She died when she was 8. So imagine what we would have lost as a family not having her with us.
Yeah.
Now, we support a continuum, right? Sometimes families cannot, right? They need alternatives, but that's it. I think that's what we want to be able to see is our system be robust enough to meet the needs of all families, no matter where they're at, and that the system is ready to support that.
Yeah. You had used the term "no wrong door." What
Yeah.
does that
Yeah.
refer to?
So, I think one of the issues that many families face and causes them to shut down is that as we try to navigate this system, right? So nobody teaches you in high school how to access healthcare, right? When you're coming out of high school, all you're worried about is, going beach, hanging out, so maybe all you need in life is antibiotics and contraceptives, right? But nobody teaches you how to deal with the tough stuff.
Mm-hmm.
So where families tend to shut down is that call one place and they say no can, but they don't help them get to the right place.
Right.
And so many of our agencies in the last 5 or 6 years have flew together to say that, our idea is that we will be the no wrong door. We will help you get to where you need to be.
Mm.
If it's us, great. If it's not, we're going to get you where you need to be. Because, sometimes making that eighth phone call is too much.
Mm.
I will share with you with my son, trying to find him a community preschool that will take children in the spectrum. Now, again, this is back in the 90s, right? Things have changed. Um, I did not have the wherewithal to be able to keep calling and getting told no. But my mom did. She got on the phone, and that eighth preschool she called was the one that took him and loved him and helped him become the young man that he is today. Right. And so I call that the Aloha Patrol, that you got to find people around you to kind of help you get what you need. But at the same time, the system, we must demand that the system is responsive and help you get what you need, where you need, instead of just closing the door on you.
I got into a conversation recently with Kavika Kahiapo, whose son also is on the spectrum as well. Right? And yes, and what a beautiful young man. Oh my goodness. And conversation similar to that with Kavika and his involvement and as a parent. And he saw that to even move the needle even that much more, right? It did mean that he needed to be involved with it, and it still now, down to today, is actively involved with autism. And maybe you've crossed paths with Kavika as well.
Yes, as well. We sure do. There are many of us whose children are all the same age, and I consider that that's who I grew up with, right? As a parent advocate, that's my cohort that, when our children are babies, we grew up together. And so, the Kahiapos have done an amazing job in not only what they've been able to provide for Jeremiah, but for the families in their communities and others throughout our state with the awareness. Advocacy at that personal level is not something that I think many people are comfortable with, because typically it comes out of a place of conflict, that there's a disagreement. And, we're not raised well, we're not raised to question our elders, question authority.
That's true.
How do we deal with it? And for many of our families, we're so grateful for what we do have that we feel like we're asking too much by asking for a little bit more or things to be done differently. So that's a lot of stuff we kind of got to get past and process to put it in a space that we can navigate and advocate respectfully and effectively.
Yeah. And Kavika's so talented too. We had the pleasure of having him on our Aloha Friday show several weeks ago, and what a fun time together we had, telling his many mo'olelo about his travels and his journeys too. And a big part of it was, of course, his own ohana and his own experience with Jeremiah and so forth. Yeah. Okay.
I think one more comment I would like to say about the family is that Kavika, but also Lori, as an equal partner in this. I am so grateful for families that have parents extended ohana to be able to do things. But the reality is that many of our families with special healthcare needs are single families that don't have the network and the breadth, which is why it's important that we talk about the community have this awareness and then the understanding and some empathy what's going on and figure out how can they help. Don't have to be clinical. Many times families or friends are hesitant to ask, how can I best support you? Because they feel like I'm not trained, I'm not qualified. But there's other things that you can do, like dropping off dinner, talking story on the phone, just some respite for the parents, just a little I love you, a note, whatever it takes, because you never know what people are going through and what kind of energy is going to take to get to the next step.
Exactly. Let's see, we got Auntie Kay dropping in. Hui, aloha, she says. I think she's on her lunch break. She's at work, but she dropped in just to say hello. So we have to whisper. Don't talk too loud because she's on her lunch break. So I got to Right here. Aloha K. And let me see. Here, Mr. Kolohi himself, Kalai Miles. This is a Waimanalo boy living in Northern California. He's going, whoo! What's up, Kalai? Thanks for joining us, man. Um, so, Hilopaʻa. So, help me with this now. Which came first, strategy or the model? Now, what in putting it
Right.
out first?
Yeah, I think the chicken or the egg conversation, I think it's your model, right? So the model is, recognizing where families at and understanding what's needed to not only meet their needs, but also move the dial in the system.
Beautiful.
So, so really, we kind of think about it for our families. We need to support them at that very first level is that awareness of understanding where their child and their child's needs fits within the family. Again, you know, the how do we support them to be able to give them the information? You know, we hear often about um, when we say, like, let's say autism, that there's so much information out there. What do you believe and what do you not believe, right? So really, I think for us is maybe is providing the necessary resources and training to families to help them better understand where their child is at. After that comes that family support, right? Is that one of the things that I think happens with families with special healthcare needs is they go into their own little social isolation. So, families with kids with special healthcare needs, COVID was no problem because we were already self-isolated because people don't understand what you're going through. Do you have time to explain? Maybe, maybe not. So they tend to hunker down and they corral their circle and they stay internal. But that's not sustainable. They need support and encouragement from others. And so, whether it's us talking on the phone to them to give them the kind of support they need, or helping their extended ohana better understand what they can be done to provide that support, that's important. And for many families, just getting through the day is all that they can keep their eye on the prize. The next level then is encouraging our families and providing the necessary infrastructure for them to be able to self advocate. Yeah, for them to be able to get their needs met. Um, too often, I give you a good example. There's a family that we're working with that needs to see a specialist. They have an appointment 3 months out. They're grateful they have the appointment, but in the meantime, their loved one is just having some very complicated issues. Now, we're taught not to make waves, right? But some of the ways that we've been able to help them self-advocate is to, hey, why don't you call them to say, we'll take the first available appointment or that cancels. Check to see if there's ongoing changes in the schedule. Offer to see if they can do something for telehealth. Again, giving families mechanisms and venues to be able to get their needs met at that individual, at that family level. And then the last piece of our model is really then, so how do we take the wisdom from our families who have been there, done that, bought the t-shirt, right? That have lived this life, that has their reality. How do we take the stories and the voices to that higher level, where they can serve others, they can serve the community, they can make the kinds of changes, and design programs for the greater good. And that's really it. Because until you understand your child and you have the day-to-day support to be able to take care of them, take care of your family, take care of your household, and you're able to articulate the own needs. At that point, that's when families are ready to take that next step for leadership. Too often, there's an expectation from the system that, oh, your child has special health care needs. Can you come to this conference and can you sit in this work group? Well, you know what? If they're just worrying about the next 6 hours of how they're going to get through the day, that's probably not a good place to put them in that corner. Um, many families want to be able to do the big picture thing because they would like to be able to share their story, but at the same time, they're going through their own personal challenges. And so, it really the infrastructure needs to be in place to meet families where they're at and help support them to where they want to be. So it's
So
pretty much
true.
our motto.
So true. Before moving to Southern California for 5 years, I had my parents living with me in Manoa, and my dad had dementia, and my mom had Parkinson's. And so I guess the blessing was I had years in the food service industry, so cooking was one of my passions. So even though I was working full time, I'd get up in the morning, I'd make sandwiches and stuff, put them. So even for dinner, my mom she still could put things in the microwave and heat up stuff and whatever. So that was fine. But after doing this, for many weeks, I joined this support group for caregivers, and I had this one mentor. I never forget. His name was Masa. He said to me, he said, "Hey, boy, you get the number one son syndrome, eh? You?" I said, "What? You get number one son syndrome?" I said, "I'm sorry." He goes, "Yeah, you the oldest son, or you the number one son? Yeah. You don't ask for help, eh? You?
Yeah.
What about your brother? You get daughter, right? I go, yeah. You ask them for help? No, I like bother them, brah. You get number one son syndrome." So he's the one that, hello, asked for help within the family members. And I remember my daughter saying, "Oh, I can't cook good as you, Daddy." I said, "Never mind. Just, is it okay if I bring them a Big Mac and some fries?" I said they would love it. They would think it'd be so naughty for them because I always cook fresh vegetables, make sure they get balanced diet. So every Wednesday, I mark them on a calendar. Malia gonna bring dinner for them, and so she would bring pizza or hamburgers, and so my mom would go all excited. "Oh, it's Wednesday. Malia gonna come with," and I would think, "Oh," and then same thing with my brother. He chose one day he and the wife would come and stuff, but it was, I wasn't ma to the fact that I don't have to do this alone. There are others that are willing to help. All you have to do is to ask to get that family support, and so
Absolutely.
yeah, so I experienced that.
Absolutely. And I have two things. One is it's reciprocal. Like we're thinking, right? Because we have the capes, right? You're number one son, we're the super moms, right? We get the cape. Um, that it's an inconvenience and an imposition.
Mm.
But really, they get something out of it too.
Mhm.
They get the opportunity to help. They get the opportunity to visit, to share space,
Oh
to
yeah,
feel like they're actually doing something that they're contributing, right? Because that's the part that is just we don't recognize and we don't talk about this kind of stuff.
right.
We don't talk about regret. We don't talk about what we're missing out. And so, being able to ask for help is a challenge, and it's a wonderful gift to skill. My second thought about this was in 2000. So my son got diagnosed in early 95. And then we had two small children at the same time, trying to make it work. We did all those things I talk about, the self-isolation, you know, just really trying to figure it out day to day. Very unexpectedly, my husband passed away in 2002. And so here I was, taking care of my aging mom who had moved to Honolulu to live with us, who had her own list of special needs, my two children, and all I could think about was if I got hit by a bus tomorrow,
Mm.
what would happen to them?
Yeah.
And so for 2 weeks, I felt like I didn't sleep, trying to figure out I need to build a support system for myself. And, so I had this conversation with God, and I said, okay, so you're going to take this wonderful man from my life, then I got to get something out of it. And what I realized that day was I was going to do two things. I was going to learn how to ask for help, and I was going to learn how to say yes when somebody offered help.
Mm.
And that, okay, 2002, I kind of almost there. I get hard times sometimes. I struggle, but I have that self awareness to like just okay, why are you not asking for help? You know, just really trying to make sure that the whole oxygen mask thing, right? When you get on the
Yeah,
airplane, they tell
yeah,
you
yeah.
oxygen on first before you help others. I cannot be the mama person advocate that I want to be if I don't take care of me, and that means asking for help. That means saying yes. Um, but I'm so proud of you, Kamaka, for engaging the family to participate. And I bet there are no regrets
Oh
on
no,
Malia or your brother's behalf
it
that they were able
spawns
to do that with them.
such wonderful experiences and memories now of us getting together. And we were so busy in our own lives and work and so forth, and the days and weeks were going by. But when we had put that stick in the sand that this day Malia was going to do something, my brother was going to do another thing, we'd have this and that. It really was so rewarding. We were blessed doubly, for that. Just asking for help. We're going to take a small kind break.
Okay.
And we're going to talk a little bit about one of our organizations that we partner with. And then we'll come back and I want to talk about the strategies of Hilopaʻa for a little bit. But across the nation, Native Hawaiians and Pacific Islanders are being disproportionately affected by the COVID-19 pandemic, folks. The Southern California Pacific Islander COVID-19 response team aims to provide information and resources to help our community so that they can stay healthy. And let's just watch this for a moment.
Talofa, I am Tuitonga Ma'atoe from the Samoan community, better known as Auntie Terry to all the folks around. COVID-19 is hurting our Native Hawaiian and Pacific Island families, especially our elders. The virus spreads easily from person to person through hugs, handshakes, sneezes, and coughs. Our elders and those of us who have diabetes, heart disease, or other health conditions have a higher risk for severe illness or even death. Lo'aina pele take COVID-19 safety rules seriously. 2 basic rules. 1, we wear a face covering every time we leave our home. Number 2, we keep 6 feet of physical distance from others when outside of our home. Lo'aina pele. Practicing COVID-19 safety rules starts with me to you. Ia manuia, whawhetai, aloha und auf Wiedersehen.
Yes, indeed. The Pacific Islander Health COVID-19 response team has a website, and you see it there on our screen, pacificislanderhealth.org. That's the place to go to learn more information on what you and your ohana can do to protect yourselves. So please check it out, pacificislanderhealth.org, for all of our Native Hawaiians and Pacific Islander cousins. We want you to stay safe. We want you to stay healthy. So please check out that site, pacificislanderhealth.org. And how appropriate. We're talking about health and we're talking about family care. And one of the founders, or the founder and actually CEO of Hilopaʻa.org, is our guest today on the Aloha Friday with the Sandwich Island Social Network, Leolinda Iokepa. And again, thanks so much for your time and joining us today. Now, we talked about the method of putting it together and the steps. So now we've got strategies over here for Hilopaʻa. Talk to us about the strategies.
Yeah, so people ask us sometimes, how do we do what we do? And, these are, I guess the key piece. One is that, if people engage us, we get them to the right door. Now, oftentimes we are able to help directly, but sometimes we cannot. But, we don't want to just say no. So our goal is to get people to the right door. So we got this no wrong door concept. We also want to take opportunities to build knowledge and skills in their families to better help support their awareness of what's going on in their family, as well as building skills that they need to be able to navigate the healthcare system. At the systems level, we work to really provide that family or consumer perspective in decision making, in developing programs, as the state is looking towards things, to really give that opportunity. We also provide through facilitation often the community perspective, that we connect the community to the programs. If there are changes at the health department in the way that one of the programs is being administered, we will work to be able to get the community voice in to help influence some of the decision making. And so, We're a community broker in many instances, in particular in the disability community, in the child health community, and in the neighbor islands, to provide that feedback in, and so that there is that awareness that, not to make policy or decisions in a vacuum. And last but not least, I feel like we're the canary sometime. We make new stuff happen. We have, some unique skills and talents to be able to pilot programs and iron them out, and then nurturing them to turn them over. So I'll give you a good example. So, in our system of care, we have programs for children birth to age 3, to really tracking development. And after age 3, if the child has complex needs, they will qualify for healthcare services through special education. But for some of our kiki, that stuff doesn't show up till a little bit later, or it may not be severe enough to be able to qualify for special education. The American Academy of Pediatrics guidance basically says we screen for developmental delays up until age 3, but we really don't do anything after that in a structured, methodic approach. So, we felt that there was a gap. And so we worked with the health department to pilot project a program called Hile, in which that we would be able to help families do their own screening using tools to see where the child's at. And for those kiddos who were on the cusp or were showing delays, that we would get them to the right front door. So we ironed out all the kinks, set it up. And then, once it was able to we've worked out all the kinks, turned it over back to the health department for them to administer more of a long-term approach, and integrate it into the system. So, we go in first where nobody wants to go, and we try stuff, and we make it work, and then we pass it on.
Now, 2021, 2020, 2021, aside from those challenges that that we faced for families and children with disabilities and adults with disabilities and special learning issues, now we got on top of that COVID that hit us all. And so 2021, we had hoped that would get a lot better. It started to a little bit in Hawaii with the vaccines and stuff, and now there's continues to be emerging, the surge of the COVID. So this is some challenges that has faced your organization and all the entities that kind of dovetail into what you do. How have you been able to kind of pivot, or what kind of move have you had to make to still stay relevant?
Yeah, Kamaka. I mean, there are no words to express, how heaven has weathered for this last year and a half. We were already a virtual organization. So for us, we've got staff on Hawaii Island, Oahu, on the mainland, actually. And so we were already working from our homes. So there was no break in service. I tried calling an organization recently, and they said, "Oh, you have to leave a message because everyone is deployed." Not us. You call us, we pick up the phone, right? So the phone system works, wherever our people are at. And so one, we were already in that virtual network. We were already responsive. So that was a plus for us. How we've had to change is that we really had to rethink and dial back the way we work with our families. Our model had been face-to-face trainings, face-to-face cohorts, building community. And we've had to create virtual communities and conduct virtual training. And that's been a challenge in and of itself. What we've offered up is to make sure that our team are able to provide technical support to families. Meaning, before we have the Zoom meeting, I'll go spend half an hour with you, making sure you know how to do Zoom so we can get on board and you're feeling comfortable. So we've had to do a lot of pivoting adaptation. We've also helped our physician community get ready for this. Now, Hawaii in 2016 passed a law that starting 2017, they would pay for telehealth services. Only 3% of the docs in the state were doing telehealth. And so last year when COVID hit, we had these opportunities to work with them to get them on board. And we were able to get people to, at the end of the training that afternoon, set up telehealth in their offices so they could see families and they could see the keiki that should not be coming into doctor's offices where people are sick to get care. So that's kind of our approach, to kind of get through COVID is to adapt. Our staff, as I mentioned, we're all part of our own special needs community. They've got keiki at home or young adults at home that they've got to adjust with. So we flexed our hours, and recognize that, they're people too, and they got families too. So we've got to accommodate and, work better together to make it work. So it's been I think it just kind of shows the resiliency of the team to be able to adjust and pivot to work with the families. So it's not unusual for us to call people back at nighttime because that's when they're available.
Yeah.
We'll do training. We've done family trainings in the evening and on Saturdays because that's when they're available.
Yeah.
We just really kind of change things to just make it easier to consume the information.
Mhm. So hilopa'a.org is the link where individuals, families can go in and get information of how to contact you all. And I love it. We're still here, COVID-19 or not, Team Hilopa'a. We always will be available, and those are all the ways. So I guess the meeting point will be hilopa'a.org. You can get all phone numbers,
Yeah.
email, all that good stuff that's there. So that in spite of the challenges, Hilopa'a still grinding them
Yeah.
out. Love it.
Yeah. Yeah.
Love it. Yeah, yeah. Um, so, a lot of our viewers to this video podcast, Leo, are folks that live here on the mainland, many of them in Southern California, who have ohana back home in the islands. And, like baby boomers like myself, have kupuna now that are aging out as well.
Mhm.
And so they're back home, and many of them are facing these challenges as well. Um, how can they support loved ones, while they're
Yeah.
here living in the States?
Yeah, exactly. Every couple of months we'll get a phone call from, you know, uh, someone on the mainland who has loved one in Hawaii and they're stuck. And so, I think many things. One is if you're having difficulty understanding the system, call us. Don't waste time. You know, I, I, the idea of somebody losing sleep because they're not sure what to do bothers me. So call us so we can try to help you out. Oftentimes what we'll do is we will, based upon the situation, connect them to community resources. So we had adult child, right? Living in Seattle, professional, living with her family, but had parents on Oahu. Um, Dad was a caregiver to mom who had dementia, and then dad had a stroke. So it's like, oh my gosh, what are we gonna do? Um, so she called us ahead of time. She was coming up. She had 2 weeks off to try to get systems and support set up. What we were able to do is kind of cut through the noise and really direct her to a community case management organization that could take up some of the legwork. Point them to the right front door for public health nursing, whatever the case may be, to make those connections so we're not wasting time trying to find the support services.
Yeah.
For a very long time, we were the ombudsman for the state Medicaid program. We're still very involved. I sit on the state Medicaid advisory. Um, so we can help explain in layman's term, how to access, healthcare, or connect them to navigators that can actually help with a phone enroll into Medicare. Kind of giving them the straight scoop. So, it's not unusual for families in the mainland to be caught in this situation. Whether it's your parents or perhaps your children have returned to Hawaii and are raising children themselves, and you're far away trying to better understand what's going on. Give us a call or email us. or text us so that, we can kind of either get you to the right front door, validate that everything that is being done, that can be done, is being done. Because sometimes that's good to know too. Am I missing anything? To kind of help out. And, we're committed to making sure that you get the straight scoop on how to best support your needs. Um,
Wow. So again, for all of our friends, there are hilopa'a.org. That's the place to go to link up with all of the various different agencies that can help you sort through it all. In fact, one of the things let me see if I don't think I have it here. I didn't have time to load that, but I have a quote over here. I'm going to read it just because I didn't have an opportunity to load it into my system. And I love this. It said, sometimes you just need someone to broker the confusing language of healthcare to your healthcare practitioner or insurance provider. That's where Hilopa'a steps in. Love
yeah,
it.
yeah,
Love it.
yeah,
Right?
yeah.
That's
We do
exactly.
that translation, right? We do that. We do that translation.
Yeah. Very, very, very nice. So, you mentioned Aloha Patrol. Um, what what is that? That's not the Aloha Patrol early morning with the surfboard. No,
Yeah,
that's a
yeah.
different.
That's the Dawn Patrol, guys.
Oh, Dawn Patrol.
Yeah, Aloha Patrol is the term that we coined, um, term that we coined for, people that you want to have in your network that can help you out. Like they will ask questions. They're tenacious. I call them the LA to a certain extent because they're the ones that can kind of help you get information. If you have a loved one in Hawaii, I think it's very important to create an Aloha Patrol here to help facilitate that. So I'll give you a good example. So one of my best friends from, small kid time, she's in the mainland. Had to the Gila girl had to go to the mainland to meet the Honolulu boy to get married,
Of
and they
course.
stayed up there, right? And then all their siblings are all on the mainland. So both sets of in-laws are still in the state. And what I've told them is, I said, I'm going to give you a pass. I'm going to give you a pass. And the pass is you don't have to explain yourself. You don't have to say why. But if you ever need eyeballs on your parents, you call me and we'll just go visit to make sure. Because sometimes you just need that peace of mind. That's kind of like an Aloha Patrol.
Well, that's
I'm
beautiful.
not right. I'm not extending any clinical or medical. I just giving you eyeballs on the situation. Now, I encourage everyone who's living away to kind of think about who in their network could do just that for them to give them that peace of mind. But also, who might be the person that could bring the McDonald's to the house or bring the pizza to the house or, kind of help up or ask questions or perhaps while you're on the mainland and that public health nurse is coming to the house to sit with the family to get their needs, could you have somebody else there sitting on the couch with them, making sure that they're hearing everything the public health nurse has to say and understands it? Because it doesn't always have to be us, right? There can be other people that we can nurture. I think about it when you have small children and you got to put the emergency list for the school. Like if you got to pick them up and you can't be there, who's going to pick them up? That's your Aloha Patrol. So how come we don't have a list of people for our loved ones that in times have enough special needs that would need some support and consideration?
Nice. Nice.
Yeah.
Wow. What a great idea. What a great idea. Uh, not complicated, simple, straightforward.
Oh yeah.
Gets right to the root of communication and making sure that the the patient or the loved one or the ohana,
Yeah.
the kupuna.
Right.
Uh,
Who's going to drop off toilet paper when no more toilet paper because of the COVID at my grandparents' house because they don't have the bandwidth to go stand in line at 2 hours at Costco.
right, right.
You know,
I just got a
those.
question. I just got a question. Can somebody drop off 1 dozen malasadas from Leonard's to my house right now? I'm just saying. But what a sweet thought and idea, the Aloha Patrol. That's very cool. Very, very, very cool. I
And
love.
I have one more thing I want to talk about real quick before we wrap up. I think the other things that we can do to help support our families is to talk story and reminisce and share pleasant memories. There is an evidence based to it that positive remembrance, yeah, when we think about things that were pleasant, whether it happened today, like calling your grandkids and saying, "What wonderful thing happened to you today?" The fact that they articulate it back to you allows them to reminisce, and it hits all those dopamine receptors in their brain that make you feel good. Yeah. So there is evidence to support that positive remembrance actually helps people beat depression, beat the COVID blues, have better mental health, have better health outcomes. And so even the Aloha Patrol themselves can ask questions like, Auntie, tell me what it was like when, you know, when you were dancing hula as a little girl. That doesn't require any extra. Yeah. But if we can get people to think about that, to help stimulate great memories, um, that is another thing we can do to really help take care and strengthen our lahui.
Absolutely. Wow. So let's see. We get brother Tim Lopes over here from Houston, Texas. This is on Nanakuli boy living in Houston, Texas. Aloha, brother Tim. Thanks for dropping in there. We love it. We talk the Nanakuli blues all the time here with brother Tim. Here's another brother actually from Kaneohe. He's now in LA. He is on a movie set. He's on a shuttle to the movie set. He's tuning in for the last 10 minutes of the show. Nate works in movies and television here in LA, and he's checking us out over there. What's up, brother Nate? And eh, Tim is giving us the shaka over there. All right, Tim. That's good. Oh, my goodness. Look at that. Time has gone by so quick.
I
My
know.
good. We just got started over here. I guess so much more. But you know what? Um, Hilopaʻa.org, folks. I'm going to bring up that slide one more time because I really, really think that this is the way in which, uh, no matter where you are, right, you have family back in the islands, you have some concerns about them and health concerns, you want to reach out and reach out to Leolinda, reach out to the organization globally, as long as you got an internet connection. Hilopaʻa.org. All the phone numbers and all that good stuff is there, and they're there just for you. And we both agree. No shame asking for help, man. No shame.
Yeah.
We no need no need be taran. That's what Masa told me. I never forgot my mentor. Look at he go, hey boy, you taran you number one son. You no make taran. So don't be taran. Now if you know,
Exactly.
you know what that means. Taran is
Yeah.
ask for help. And Leolinda, thank you so much for all that you do for our community back home. And we really, really, really appreciate you. I know you're busy. You're traveling a lot. You're involved with so many different agencies, and you're on different calls. But thank you for your time. Really
Oh,
appreciate it.
Kamaka, thank you so much for the opportunity. I'm so glad to hear all about the network. You know, all those years ago, I lived in California. It would have been nice to be able to connect,
Yeah.
um, in this way. So mahalo to you for what you're doing for our community, and thank you again for inviting us to spend time with your audience today. Mahalo.
Absolutely, absolutely. So for now, we're going to say mahalo to Leolinda, and wish you and your organization all the best as you move forward through this pandemic. I know there's some surges happening back home right now, and you have challenges facing you every single day as well, and so we appreciate you. All right, so we're gonna say aloha no mahalo. Thank you so much,
Abuelo.
Leolinda. Ahui ho. Ah, so sweet. She's joining us all the way from Oahu on the islands, and we want to thank our wonderful Sandwich Island social network supporters who are sustaining members of our ohana. We got June Shibuya, Larry Ann, Hedy, and Duha. Kay Bennett, Jim and Reba Maraboto of Meheula Music. They have joined our Patreon platform with monthly donations to help us continue the work that we do. And remember, if you would like to be a sustaining member of our ohana over here, we would love to have you join us simply by going to our Patreon platform. And that's very simply stated right here is patreon.com/Sandwich Islands 808 is how you can join us. And we want to also acknowledge donations by Thyra Abraham, Suzanne and Roddy Gregory, Jean Dahlberg, DC and Tuila Makaena. Mahalo. All your donations help the Sandwich Islands Social Network continue to create and sustain programming throughout the year. So for now, we say aloha until next time. And by the way, next week, Friday, we're going to enjoy, and this, I'm so excited about this as well, Ledward Kaapana, Slack Key Icon. He said, "Bro, I'm going to come and I'm going to just press." I said, okay, we're going to be lead heads next week, Friday, on the Aloha with the Sandwich Island Social Network, Slack Key Music Icon, Led Kaapana. How fun is that going to be next week as well? So for now, we say mahalo nui loa. You all have a great rest of the weekend. You guys be safe out over there, and we will talk to you soon. Aloha, everybody.